All right, so now we're going to talk about Parkinson's. Parkinson's is chapter 59, chronic neurologic problems, same chapter as seizures, page 1432. So basically, what is it? It's lack of dopamine. That's basically the basics. Okay, so I like to just talk about the clinical manifestations first, like what are we going to see, how are we going to assess this patient, what are the diagnostics, how to like make sure objectively to know, and complications I like to talk about, and then I like to get into the interventions. Okay, so how are you going to be able to see this? There's initial signs and there's later signs. So that's really important to know. And what are the three like triad things to know is bradykinesia, tremor, and rigidity. Remember that. Bradykinesia, tremor, and rigidity. Okay. So our initial signs are going to include, you're going to see a slight limp in these patients and a decreased arm swing. So slight limp and decreased arm swing. Our later classic is that shuffling gait, propulsive gaits, the arms flexed. So shuffling gait, propulsive gait, arms flexed, and loss of postural reflexes and speech. So these are later signs. All right, so let's talk about our three triad things that we need to know. So basically, bradykinesia, we're going to see retropulsion and propulsion. That was called the shuffling gait. The shuffling gait as well. So, which is called festination also. Drooling of saliva. These are all associated with bradykinesia. That masked deadpan face, stooped posture, all of that is bradykinesia. The tremor, we're going to see that pill rolling move with the fingers. The rest and stress, it increases this tremor. Hands, diaphragm, your hands, the diaphragm, the tongue, the lips, the jaw can all be affected with this tremor. Rigidity is resistance to passive range of motion. They use the word cogwheel. I'm going to go research that more into that. And difficult to move. So let me actually check that real quick. Cogwheel. Cogwheel rigidity. It's like jerk responses of body muscles when force is applied while bending a limb. The cogwheel jerk does not happen in normal circuit. It's usually a common occurrence with, oh, I see. Interesting. Very interesting. So it kind of goes like back and forth. So it uses the word cogwheel specifically. So if you see that in the test question, it's cogwheel phenomenon. All right, know that. That stood out to me. All right, diagnostics, we're going to do 2 out of 3 of the triad symptoms that I talked about. What was the triad symptoms? Bradykinesia, tremor, and rigidity. Your CSF decreases in dopamine, so they can get a CSF and see that there's less dopamine there. Responsive to Parkinson's drug can be a positive sign. MRI, you may see. And there's a pull test, which measures the postural instability. So you get pulled, back of your shoulders and see how unstable your posture is. So what are the common complications that have to do with this is psychiatric. It's associated with dementia, dysphagia, aspiration, nutrition, also especially if it's affecting the diaphragm, and also like shaking, like being able to hard to eat. Immobility, pneumonia, skin breakdown you want to think about. For motor, you want to think of weakness, dyskinesia, akinesia, and orthostatic hypotension, falls, postural reflex. And also careful for paradoxic reactions of excessive dopamine from the medications itself. So how are we going to intervene with these patients? Let's think about a nursing first, and then we're going to talk about the surgical, the nutrition, like at home, and pharmacology. So the first thing that we're going to want to do is, for nursing care, we're probably going to want to promote independence as much as we can. We want to elevate the toilet, have them have elevated toilets because it's hard for them to move and they're rigid. Coordinate care for PT, OT, so like coordinating care for referrals and getting them to collaborate with them. You want to avoid contractures, so like get them to range of motions, exercises even if it's passive. Fall precautions, encourage exercise to help with this. You're trying to prevent muscle atrophy, you're trying to prevent contractures, you're trying to prevent this constipation that can happen from immobility. So safety alerts to look for. They may freeze while they're walking, which is a risk for falling because, yeah. Teach to consciously think about stepping over an imaginary line on the floor. That's what you want to teach. Drop maybe rice kernels on the floor and step over them. You may want to rock from side to side, teach them to walk from side to side. Take one step backwards and then two steps forward. So maybe one step backward, 2 steps forwards. These are things to help teach the patient. For surgery, there may be options for like ablation, transplantation, deep brain stimulation. There is some surgical options out there for this. Let's talk about nutrition real quick. So levodopa impairs the absorption of B6. Let's talk about that. So you may want to give them B6 as a supplementation for that. And it may limit protein to evening. You may want to limit protein to evening meals. I got to look more into this. A lot of work. Okay. Pharmacology, the main things to look for in the pharmacology is it may like work off and ons. There may be an endodosing effect. So off and ons, let's talk about that. Like hypomobility. Hold on. So dopamine is a precursor for levodopa and carbidopa. So let's talk about that real quick. So levodopa and carbidopa enhances dopamine. Carbidopa inhibits the enzyme that helps levodopa reach the brain. So the effects can decrease over time. So side effects is dyskinesia and unpredictability. There's a lot of medications. Anticholinergics, they block and inhibit ACH, which decreases the parasympathetic system. So like benzotropine. COMT, entacapone, tolacapone, prolong, not used alone. There's other things. Wait, we talked about endodosing. Okay, DA agonist. So like bromocriptine, dizzy or faint due to orthostatic hypotension. The first dose you want to think about. That's a DA agonist. There's the MAOI, the block breakdown of DA, saligan, and razagilan. That's really an antidepressant. And then there's airmorphin, which is a sub-Q taken with trimethylbenzamide, not the other types, given during off periods. So all of these are considered, so Lenny's for seizures and Lenny's for Parkinson's may be interesting to look into because it didn't say much in the textbook. I have the medications here, but I don't have a lot about like what are the complications and what to look for. So that would be interesting. But the basic overview of like how to take care of these patients I have down. So that was the basic overview of what I have for Parkinson's. Love to hear from all you guys. And that's Parkinson's. So happy studying.